Hello, welcome. Thank you so much for coming in. We are so glad to have you in the podcast room and studio of the Express News. Today, we're here to talk about a very important conversation. Open enrollment is coming up. It's days away. And we have had this conversation for 3 years in the making, and it's an important one that we want to inform and educate the community around. So I'm here today. I'm Sarah Bryant, Senior Director of Marketing at the Express News, and I am with Brandie Gamboa, and you are the Director of Government Programs with Community First Health Plans.
Yes, thank you. Thank you for having me here.
Yes, we're so glad to have you here. So in terms of what we're going to discuss today, we're talking about Medicare Advantage, upcoming updates, and what beneficiaries and caregivers need to know about 2026.
Okay, yes.
To start off, I want to thank Community Health First Plans and Gonzaba Medical Group for having this panel discussion for 3 years now. We've been able to communicate to the community what the changes are coming up. And we also, within this podcast and environment, have about 3 other podcasts that come through here, but all of the important conversations that we need to educate the community about happen in this room. So we're just glad to have you and your brand as a part of it. So without further ado, I think we always start off just with a base knowledge for people in terms of what should people be asking this year, because every year it seems like open enrollment comes around and there's comparisons, there's new plans, there's original, there's light, but in 2026, are there updates to share with the community?
Yes. Well, first, thank you for having me here.
Of course.
We appreciate this. Any kind of knowledge that we can share with beneficiaries out there, it's always been important to us as a local community issuer. So thank you very much. There are some changes, but there's also some things that a beneficiary should look at no matter what, whether there's changes or not. So one of the things is to ask themselves, what is the difference between original Medicare, also known as traditional, versus a Medicare Advantage plan? And some of the questions they should ask themselves is there an additional premium to enroll in a Medicare Advantage plan? Under original Medicare, most Part A is free, and then Part B does have a premium. They will continue to pay those premiums in traditional or original Medicare, but they could also have an additional cost for enrolling in a Medicare Advantage plan, so they have to be careful. If they don't want an additional cost, they need to look for a Medicare Advantage plan with zero premium.
Okay.
So that's one important question they really should consider.
And when they're looking at it, is there a way to indicate it?
Absolutely, yes.
Yeah.
So if they go to Medicare.gov, they can start looking at the different plans that are offered, and it will tell you right there in the very first line, usually premium cost. So that way they can have an idea whether it's going to cost more or not.
Yeah.
I also always encourage them to work with a licensed broker because those licensed brokers are very knowledgeable and they know about different plans and they can help them through the process.
Yes. Oh my gosh, we need a map here.
Yes.
Yes. Absolutely. So in terms of what that premium or what the plans are changing for extra benefits, because anytime, you have a cost or a premium, you kind of want to know what's in there. So things like dental, vision, transportation, beneficiaries and caregivers, how can they understand what's really included? And then how can they know if they qualify for programs like dual special needs plans or special supplement benefits for chronically ill or over-the-counter supplements?
Well, with extra benefits, it's very important to look at all Medicare Advantage plans offered in their service area to see what's going to best fit their needs, because they do offer extra benefits, like some will offer dental, vision, over-the-counter, which is for over-the-counter medications. They'll offer things like transportation or meals. What's important to them? If getting to their hospital visit is important to them. They want to look at the transportation rides. What's the eligibility for it? How many rides they get per benefit year? If they know that they are frequently in the hospital and meals after post-hospital stays are important, then they want to look at what's the eligibility to qualify for a meal and how many meals will they provide in that benefit year. Then they want to check, do I qualify for something that's, extra, like a DSNP program? A DSNP program is a dual eligible special needs program. It's for those who qualify for Part A, Part B, and Medicaid, and they live in the service area. And those can come with even extra benefits like the supplemental benefit for the chronically ill, which can give them funds for like living support, like paying their utilities, paying for their groceries, because we want to make sure that they stay healthy. And that's part of being healthy, is having AC in your home, or having light in your home, or having groceries that you can purchase that you can eat and keep yourself healthy.
Yeah. I mean, we live in a hot area, and
Yes.
AC is very important.
It is.
And in particular as you age. So that's really good to know. So in terms of how and when they're looking at this, how do they know, like in their service area, is that also at Medicare.gov?
Yeah, so Medicare.gov, they'll put in their zip code and they'll see
Okay.
what plans are offered in their area, and they will also see what extra benefits are offered.
That's awesome.
And that's why, you can go onto Medicare.gov and you can look at the different plans on your own. But that's why I also encourage a broker just to help them, because since they are so knowledgeable, they can say, oh, well, based on what you've told me, your health condition, this plan might be the better fit for you.
Yeah, no, that's important. The customization.
Yes.
Instead of the one size fits all. Yeah, that is a differentiator there in that conversation. So when looking at both costs and access, so important, both of those factors, what questions can people ask to avoid surprise?
Yeah, that's a really good one, because a lot of our beneficiaries will get surprised because they didn't review something ahead of time before enrolling. So we want to avoid that.
Yes.
So some of the things they can look at is their out-of-pocket costs. Now, they won't know for the year what's going to happen, but they can estimate it based on what services they have frequently used in the past. So they can look at the different Medicare Advantage plans and say, okay, I know that I'm going to need this therapy sessions for a while. And under this Medicare Advantage plan, it does cover it, and this is the co-payment, or this is the co-insurance for it. So they can estimate their out-of-pocket costs based on their frequently used services, so that way they're not surprised on what their costs are going to be once they're enrolled in it. Another thing they can look at is my provider in the network? Because if they want to see their same provider and they're not in the network, they're going to pay out-of-network charges, or they're going to be denied services. So very important to make sure that that doctor that they want to see is in the network of the plan they chose.
Yeah. And can a doctor change being in network or not being in network, like throughout the year?
Yes, they can, which is also important. So what happens is, if beneficiaries are already enrolled in a Medicare Advantage plan and they're happy with that plan, they forget to check the network for the upcoming year. And that doctor may have fell off that network.
Right.
So it's very important, even if you're going to go into your same plan, check that provider network.
Yeah, so true. This happened to my mom, and it was like all the medical records that, he had and kept. Then, of course, she's like scrambling because it was
becomes
a surprise.
difficult. Yeah, it's difficult.
Yes.
So, yeah, that's something that's very important.
I know. I was unexpected surprise indeed.
Yes.
So when someone is reviewing their plan, what are some of the, practical base level questions that they need to be asking? Surprises are very important, but just like, here's the base level of what I need to ask.
I think the very basic questions is some of the stuff that we've already reviewed is there going to be an additional premium?
Yeah.
What are the out-of-pocket costs going to be under this certain plan? And is my provider in that network so I avoid out-of-network charges?
Yeah. In terms of changes, there are always changes. Last year we talked a little bit about changes to supplements and over-the-counter prescriptions. The rules this year in 2026 in terms of prior authorizations, they've changed a little bit. What do people need to know?
They need to know that for prior authorizations, Medicare Advantage plans can require prior authorizations for services, procedures, and some medications. And Right now, Medicare Advantage can set their own guidelines within federal limits on how they handle those prior authorization processes. So that could delay services sometimes. So for 2026, the federal regulations, first they said we have to provide more transparency.
Okay.
We need to be more timely on our decisions for prior authorizations, and they limit the reasons why we can overturn an approval. So what beneficiaries need to worry about is, one, looking at the summary of benefits, looking at the evidence of coverage for each plan, and checking what prior authorizations are required. Then they need to look at the appeal process, because if one of their services is denied, they need to know how to appeal it if they should appeal it.
Oh, wow.
So there's some of the changes. Really, the changes are more for the issuer, but it's good for the beneficiary because it's going to provide more transparency in our processes and what we're allowed to do and what we're not allowed to do and what they need to do if denied.
I love that. We love transparency at the
Yes.
Express News. Looking ahead at 2026, what are the most important Medicare dates? Because I cannot keep track. This year is flying. When do we need to know and look out and mark on our calendar?
Well, the very important one's coming up.
Yes.
Annual enrollment, October 15th through December 7th.
Yes, that is coming up.
Yes, right around the corner.
I know.
And this one is important because during this time, they can either enroll in the Medicare Advantage plan, they can drop it, or they can switch plans. So they have a lot of options, and they don't want to miss their opportunity. If they do it before December 7th, their new plan will become effective January 1st, 2026.
Okay.
The other important date is also open enrollment. Open enrollment's different. That is from January 1st to March 31st. For this enrollment period, anybody who's currently in a Medicare Advantage plan, they can either switch plans or they can go back to original Medicare.
Okay, so when they're already on an Advantage plan, if they want to take advantage of things, they're in the January looking at and reviewing. If they're not, then they're October 15th.
If they're not in a Medicare Advantage plan, yeah. But even if you're in a Medicare Advantage plan, you can still make your changes and stuff during annual enrollment.
Okay.
Yeah.
All right. Well, that's good. Every single year, my mom is aging. I am an only child, so I'm the only caregiver. As a caregiver or a sandwich generation, what advice do you have for the caregiver? And how should they be looking at or advising their parent or a child of special needs?
I would tell them to help them through the enrollment process, to help them look at all the different benefit plan options. But it's very important to make sure that they're looking at the actual documents and not just through Google. So request a summary of benefit coverage, request the evidence of coverage from these plans so that you can review it in detail and make sure it's going to be the best fit for you. Also, to make sure that they're not taken advantage of and fraud doesn't happen to them.
Yes.
They want to make sure that they're not giving out their personal information, their Medicare number to people that they don't know.
Yes.
During this time, unfortunately, we do have a lot of people that are calling unsolicited, trying to get information, and they shouldn't be. So they just want to know that Medicare is not going to call them out of the blue and ask them for information.
Right. I know. When my mom is around me, there's so many like fraud calls in the time that we're hanging out because it's like she's obviously being targeted as a senior. So that was actually going to be a question that I had in terms of fraud. Are there any flags other than the phone and picking up and somebody requesting their information that we should flag for the community to be aware of?
It's not just calls. Now it's
Right.
text messages, it's emails. I mean, even myself, I get text messages saying, enroll in Medicare now, or your deadline's approaching, you're going to miss the chance to have Medicare, don't wait. It's like almost threatening, like telling me there's a sense of urgency. Right away, you know that's a red flag.
Yeah.
So just be aware of that. And if you do get calls or unsolicited text messages, you can report it. Report it to 1-800-MEDICARE. So
Okay.
that way they can take action and make sure that they protect our beneficiaries.
That's amazing. And I also have heard from like Social Security numbers being asked of through text, email.
No, yeah, don't do it.
Yeah.
Yeah, don't do it.
Don't do it. Don't give it.
Yeah.
Yes. So nobody's going to contact me from Medicare. Nobody's going to contact me from Social Security. via the phone or text.
Yeah. They usually send letters, and with licensed brokers, they're not going to contact you unless you ask them to. So if you went to a marketing event and you sign up and you say, you know what, I do want to be contacted, I want to know more information, that's when the broker says, okay, I will call you. They're not going to call you without permission. So that's how you know they're a licensed broker as well.
Yeah. I have heard a term, and I don't know what it means. I would love for you to help me in terms of buying or supplying through a local issuer a plan. What does that mean? What is that about? Tell me.
So a local issuer is basically a organization that's offering a Medicare Advantage plan within their own community. So they are there with them. And it could be a very good thing. And the reason why is because beneficiaries may be able to get in-person support. They can walk into a building and say, I need help with my benefits. They can also maybe have a local call center so they're not calling some different state. And because local issuers focus on a specific region, they're able to tailor their benefits and their services to the local population and what they need. So it could be very important. Not only that, but local issuers also contract with local hospitals and providers and pharmacies within the area. So it's more in-network providers that are closer to your home.
Makes sense.
So it can be very beneficial to go with a local issuer.
Yes. So how do I find a local issuer? Where would I, how would I know that if they are?
Well, when you go to Medicare.gov and you look at the different options for Medicare Advantage plans, you can look up the organization and where they're home from. So where do they house? Where is their home building in?
Okay. So I'm looking for an home office in San Antonio, and then that would open up the world of local issuers.
Yes. So, for example, if you're in Bexar County, well, if the local issuer says they are actually in Bexar County, then you know that's why they're local.
Fantastic. Thank you so much, Brandie, for being here. And thanks so much to Community First Health Plans. We have appreciated the partnership through the years in informing the community about the changes or the stay the same, if you will, to the Medicare space and world. We really appreciate your expertise coming on. And we do thank our partners, Gonzaba Medical Group, and we're so glad to be a part of educating the community.
And we're so glad to be here, so thank you for inviting us.
Yes, fantastic. For those looking for more resources and details, be sure to visit our Medicare guide at mysa.com/Medicare. Thank you all for joining us today, and we hope you feel more confident and prepared as you navigate Medicare in 2026.